I'm gonna hopefully you just got a message about this webinar being recorded. We'll send out an email later today with the recording that you can pass along to anyone else that you want to bring up to speed. And now I'm going to turn things over and we'll introduce the Voices team and pull up our PowerPoint slides here. I'm Emily Murphy, and I'm the Chief Policy Officer at Voices for Virginia's Children. And I'm going to turn that over to Allison.
Oh, hi, everyone. I think we're pinning. There we go. Hi, everyone. I'm Allison Gilbreth. I'm the Policy and Programs Director at Voices for Virginia's Children, and I lead our child welfare work. And I'll pass it to Emily Moore.
Hi, happy Friday, everyone. Emily Moore here. I use she, her pronouns, and I am the policy analyst for public health and social determinants of health here at Voices. And last but not least, I'll pass it over to Kristen.
Hey, y'all. Good morning. This is Kristen Lennox. I use she, her, and we pronouns, and I am the Advocacy and Engagement Manager over here at Voices. Back to you, Emily.
Thanks. Well, thanks everyone for being here this afternoon and for being with us to learn more about what's in the governor's budget proposal that came out yesterday. This is our opportunity to go through the details and tell you a little bit more so that you don't have to. And then we'll all be prepared and ready to rock and roll when the General Assembly comes back in January. I think most of you know Voices, but if you're not familiar with us, we are the statewide multi-issue child advocacy organization. That means you'll hear from us today on a number of issues affecting children, from children's mental health, family economic security, foster care, early childhood education, healthcare access, as well as opportunities that you can get involved during the General Assembly this year. We have some good news to share, as well as more work ahead to do this General Assembly. So we'll also be giving you some links to ways that you can connect and share in the coming week with the Virginia General Assembly. So, Kristen, I think we're a couple of slides ahead here at this point. We wanted to just make sure that we reiterate how we come about these policy priorities and where we get our information at Voices. We are centering equity, both and just futures for young people. Our priorities and our perspective is shaped by young people and the partners who are child serving professionals in this field. So thank you for being a part of our understanding and helping us to better inform this policy agenda. And I think also wanted to switch things over to Kristen to tell you a little bit more about opportunities to get involved and the young people that are working with us.
Thanks, Emily. I am the Advocacy and Engagement Manager, as I shared, for folks that are unfamiliar with me. And that is a fancy way of me saying that I love to convene people, support people, and create pathways to advocacy for community members, for workers, for anyone that has a story that needs to be heard, to support policy that will champion young people and their needs and their families and their communities. So you can connect with me at any time. Someone should be dropping a Calendly link to me in the chat if you want a one-on-one consultation, a small group. It's helpful if you let me know who you're planning to meet with or what talking points you're kind of mulling over, but happy to coach folks through just the legislative process and effective ways to use that brief meeting time with legislators if you're setting up some meetings this session, or if you're preparing for an advocacy day as well. So it's always great to practice and to get some extra insight sometimes as you start to get ready for these meetings. So you can find me here, and my email address is here as well. We do have some upcoming opportunities already. We have we know that the General Assembly is going to reconvene for their 45-day session because it's an odd year here on the 9th of January. On the 17th, right after MLK Day, we'll have our own advocacy day all around youth and young people. And we will have our great pilot group of youth advocates, Virginia's Youth in Action. It's been an amazing experience working with these folks this year. We also have Healing for the Healers in partnership with Child Savers. That advocacy day is on Wednesday, January 25th. You can connect with Allison or Alex Guzman from Child Savers for a little bit more about that. We have Foster Care Advocacy Day on Wednesday, February 1st. This is in partnership as usual with Children's Home Society. And then hopefully wrapping up the General Assembly session by the 25th or earlier. And I'll let our policy folks speak more on that. Yeah, so all my links and somebody, yep, thank you. Allison dropped also the Healing for the Healers registration link. My Calendly's in there. And that's everything from me. Did I miss anything, y'all? All right, I'm going to turn things back over to you, Emily.
Great, thanks, Kristen. Yes, sign up to register. This is more of an in-person General Assembly here after we've had some hybrid opportunities as well as in person. There will still be the same opportunities for folks to watch the General Assembly and give testimony online, but we are anticipating more people to come and host their advocacy days, meet with their legislators at the Capitol this year. There will be probably a few other advocacy days to come, and others are welcome to share as well. Please, if you have another opportunity, drop it in the chat. All right, well, we'll kick things off in talking about our takeaways from the governor's budget announcement yesterday. So, and for folks who are less familiar with Virginia's budget process, what happens each year is that we have the governor gets to propose amendments to the budget, and the legislature then takes his proposal and decides if they're going to add or adjust any of his amendments, and then work through a negotiation process to create our final budget. This is the second year of our 2-year budget, so Governor Youngkin in this case is making some changes to the budget that was proposed by Governor Northam last year. We do have some key themes that we want to highlight, and then we'll go through some more detail as well. You may have heard on Wednesday, Governor Youngkin gave a preview of the behavioral health and mental health initiatives that are in the budget, signaling that this is a priority area for him. We were excited to see an additional $230 million in new investments and something specifically for children in this mental health investment. I took stock of this as being at Voices for about 10 years now, that this is one of the first times the governor's budget has proposed additional mental health resources specifically for kids. We've always been able to get bipartisan champions from the General Assembly to support these issues, but this is the first time in the time I've been around that a governor is taking some leadership on this initiative, which made me excited in this position. The second big thing that's in our budget, as is always, a look at what resources are available through our spending and our revenue projections. We are fortunately in a position in Virginia where we are recording record revenue surpluses based on strong economic performance and economic climate, and some under expectations of what would happen. That has allowed previous governors to create some tax relief and reductions in taxes in their proposals. Youngkin's includes 2 proposals here, a reduction in the corporate tax rate and the individual tax rate. We'll tell you more about that, but it does also mean that with these tax revenue proposals, we're facing additional lack of funding that could be spent on other system priorities for kids and families. We'll also have some questions and concerns as lawmakers who have created these budget proposals have flagged that we could be facing a recession in the next 6 months as well. And so we know our budget picture may not be quite as rosy. A couple more areas that we always want to lift up and see as big priorities in the budget are around healthcare access and education. This year, we were glad to see some resources redirected to help with the process of keeping folks insured in Medicaid and FAMOUS when our public health emergency ends, and facilitating that eligibility redetermination process, and resources to continue to expand our education system, at this point targeted to our teachers, who we know are greatly deserving of these resources, as well as targeted interventions for early literacy and math, as well as some in the early education space for mixed delivery preschool. So those are some highlights, and we will go into some more detail in these topic areas. Next, I'm going to switch things over to Emily Moore.
Hi, everyone. So we are going to jump right into our policy priority areas, talking right now about mental health. So this graphic that you see here, which may be kind of small on your screen, so happy to share this with you if you're interested, is from Governor Youngkin's Right Health Right Now plan for behavioral health system transformation. This shows an investment of $230 million in new funding into mental health initiatives across the continuum of care, which you can see here, from prevention, including some workforce support, to crisis services, to long-term wraparound services and support. This is really a thoughtful plan that shows a continuum of building blocks for a comprehensive behavioral health system. But as we all know, there are some missing pieces to these blocks, and that's really the glue that holds them together. The infrastructure that needs to be built through Medicaid funding, through staffing at the Department of Behavioral Health and Developmental Services, and at our local CSBs to implement these services and support. And so while this is a remarkable investment from the governor, we do expect that during the upcoming legislative session, the General Assembly will continue to enhance and build out the missing pieces of this system through additional investments, as they have in years past. Meeting this moment for youth mental health is going to really require continued investment, long-term investment, and major shifts in how children and youth are prioritized in our mental health system. Next slide, please. So I don't think it's news to anyone on this call, or if it is, then we're going to share this with you, but far too often new initiatives and expansions in services have really delayed the implementation of child and youth focused plans until phase 2 or part 2. And at Voices, we envision a system that prioritizes youth mental health, when they need support and where they need support. The investments that Governor Youngkin has put into this behavioral health plan are really a step in the right direction towards the system that we hope to see. But an important thing to note that in the budget language, it's less specific around young people than the governor's justification through the Department of Planning and Budget, which could potentially mean that there isn't as much of a focus on youth-specific implementation. And so that is really where we are focused in this, is ensuring that the initiatives that are carved out do end up being implemented with youth and young people in mind. So some of the notable investments that are included in the budget related to crisis services are $58.3 million to fully fund DBHDS's request for a comprehensive crisis system. This will create a position specific to children's crisis services and increase the number of 23-hour crisis receiving centers and crisis stabilization units. Our talks with DBHDS have let us kind of understand a little bit better about how this money would be split out, and about $19 million of this $58 million are dedicated to services for children and youth. $20 million to fully fund 30 new mobile crisis teams to respond to the 988 hotline calls, which is a critical investment to decriminalize mental health care by creating police-free crisis response when possible, and ensuring that folks can come to the individual, the young person, the adult that needs that crisis response in their community. $20 million for innovative hospital-based psychiatric emergency alternatives and supplemental payment programs that will redirect care to more appropriate settings. You can kind of think of this as a psychiatric emergency department to specifically serve those mental health needs when they arise. What we know is that a lot of folks are being boarded in emergency rooms, waiting there without necessary services. So this creates an alternative to that to ensure that they can get that emergency crisis support when they need it. $1 million for contracts with local law enforcement agencies that agree to use off-duty police officers to transport and maintain custody of an individual that is awaiting admission to a mental health facility or for whom a bed has not yet been identified. We would love to explore the alternative custody pilot a little bit more to ensure that there are other alternatives to policing for folks to transport individuals that are under an emergency custody order or a temporary detention order. And so we are part of the Governor's Office TDO Task Force, the Prompt Placement Task Force, which we hope we can have deeper conversations about alternative custody and further decriminalizing mental health care. And then finally, language to combine funding for alternative custody and alternative transportation. Really what this means is the combination of funding is going to ensure that the components of both of those systems, both alternative custody and alternative transportation, are compatible with each other and can support that continuous care for folks that are under a temporary detention order. So what was not included in the crisis services budget is specifically DBHDS's request for a training academy for partners involved in emergency custody and temporary detention processes. The purpose of this program was to increase alternative custody options and ensure consistency across the system. And again, we are hoping to have some deeper conversations around that in the TDO prompt placement work group. I am going to pass it back to Emily Griffey, and she's going to share the investments in school-based services with you.
So sharing a little bit more about some other pieces in the budget around mental health. The nice thing of this continuum is that mental health is spread across various agencies within state government, and some of these initiatives are as well. I see a question from Mike Royster about preventative services and social emotional initiatives in the education system, which I do think some of these initiatives will touch on as well. So we are excited to see some additional funding for school-based mental health resources. Voices led the effort last year with a budget amendment that was championed by Senator Jennifer McClellan to put in a pilot for school-based mental health integration services to allow the Department of Behavioral Health and Development Services and the Department of Education to collaborate around flexible funding directly to school divisions to boost their mental health service capacity. We had $2.5 million in the budget last year. Governor Youngkin ups this to $15 million in his investment here and creates and takes out that it's going to be a pilot program. It's going to be a permanent program and allows public providers, private providers, and schools to be eligible to receive those funds. So we're excited to see a large scale expansion of that and hope that this can address some of those prevention and social emotional initiatives as well. There's also some funding to contract for telehealth services for mental health in K-12 and higher education settings. This funding goes to SHEV, which is the State Council on Higher Education, to create a contract and to look at what that looks like in telehealth. We know telehealth has been something that has been critical with the pandemic, is great for working with young people. And so we're glad to see a creation and an investment in telehealth. I think some schools are already definitely doing this. So we'll see how this can fill in some of the gaps. What we would like to see to also help fill in some of the gaps is how Medicaid can be used in school settings to continue to fund these efforts and to ramp up mental health services. One thing that we know right now is that therapeutic day treatment, or TDT, has been less used in schools as a result of the pandemic, and was on the radar for our Medicaid agency to begin looking at redesigning that services and deciding what are some new practices that should be included in school-based settings, as well as youth peer support services in those spaces as well. So we would really like to direct the state to begin thinking about those initiatives to help fill in some of the gaps in the mental health system and to look at Medicaid as another resource. Another thing that will be coming online is for schools to bill Medicaid directly for health and mental health services that they initiate in a school setting. And so we'd like to be able for schools to have some technical assistance about how to bill Medicaid and how to get that one-for-one, dollar-to-dollar match for providing those services so that they can grow and sustain their mental health services in the future as well. So we do see more opportunities to grow in this space and to connect schools as a place where mental health and prevention lives for kids and adolescents. Back to you, Emily.
Thanks, Emily. That is the one thing you all will now see at Voices. You can say Emily and one of us will answer. So there are several other mental health investments related to workforce and system improvement included in the governor's budget. So we've outlined those here. A couple to note are a contract with a consultant to assist in implementing a plan to transform behavioral health. I'm not really sure the details of what this will look like, but as the Secretary of Health and Human Resources and the governor's administration work to plan out this, what is a 3-year transformation, I suspect that the consultant will help to poke holes in any areas and identify areas for improvement. $2.5 million will go to increasing funding for the behavioral health loan repayment program. So this is really exciting. This funding increases loan repayment awards from $30,000 to $50,000 for child and adolescent psychiatrists, psychiatric nurse practitioners, and psychiatrists. And it also allows psychiatrists who are in residency to apply and qualify for loan repayment. So that will help with that pipeline to workforce. What we do know in Virginia is that we only have about 14 per, I think, what is it, Emily, 1,000 children for child and adolescent psychiatrists. And so we have a very, very large shortage of child and adolescent psychiatrists, and hopefully this will help to fill the gap there. $1 million to add supplemental payments to fund graduate medical education for 20 psychiatric residency slots, again, filling that pipeline from students and folks that are in education into the workforce. And then language to remove administrative barriers to accessing peer recovery support services. So this will remove barriers and do things such as adjusting caseload limits for peer recovery support services and peer recovery specialists. And it will expand provider qualifications that will allow for an individual who's working on their 500 required hours of supervision to be approved as a Medicaid provider type. So we're very happy to see these changes here to make it easier on our peer recovery specialists to fit into this workforce as well. Back to you, Emily.
So after mental health and the significant investment that we're glad to see, we would like to see regardless of any budget picture, we do want to give you a sense of the budget picture based on how taxes shake out in our state. And so as you know, we've seen an unprecedented budget surplus. Our budget coffers look strong going into this General Assembly session. So we hope that we can get some much needed investments in our underfunded systems, especially around mental health, education, and foster care. What's also in the budget is now taking away some of the revenue due to these tax proposals. And what we see here is that there is a proposal to reduce our corporate tax rate by 1% to 5%. That has an impact of $362 million across the current fiscal year and next fiscal year. The governor has said that he would like to see that go even lower. Another tax proposal is to reduce the tax on the highest income bracket, which is actually most people in Virginia. We have pretty much a tax bracket of 5.75% now that is for anyone earning over $17,000. But reducing that by 1/4 of a point would reduce our revenue by $333 million next year. And there were other proposals that came from JLARC, our legislative policy review committee, who suggested rather than a small change to create stair steps of income brackets in Virginia, that legislators have been proposed to make consideration. What we don't see in the current mix is any expansion of our earned income tax credit or any consideration of families that have children and what the tax relief may look like for them. Last year, Virginia passed a state version of a refundable earned income tax credit that is targeted to our lowest income families. And we'd like to see that be boost to the maximum allowed amount of 20% of federal credit. And many other states took the lesson of the federal government that provided the expanded child tax credit and have created their own version of a state tax credit. We'd like to see that happen this coming year and consider how children are an important part of the family budget equation, and that it does cost families a little bit more to care for their children. Oh, Lena, so glad you're on and included the information about the school-based pilot. You want to add anything else there? And I will turn things, and so I'll talk a little bit more about economic security here. With that, without a whole lot of additional tax relief in the budget, we didn't see any additional continuation of our increase in assistance around TANF payments or additional SNAP food benefits. But we did see that we do think will be helpful is this process of reapplying for Medicaid that provides access to affordable health care for over 40%, 45% of kids in Virginia. That's huge help to families, as well as some targeted relief to two-parent households that may not normally qualify for our financial assistance provided through TANF, to make sure that the funds are available at the state level to fund those two-parent households. Turn things back over to Allison to talk about child welfare.
All right, thanks, Emily. So in the child welfare area, it wasn't a huge year. I would say it was pretty average. They put a ton of investments in mental health, which for my folks who are in the foster care policy network, you all have talked to me so much over the last year about how the mental health system inadequacies really impact the child welfare sector. So we're really happy to see some of those moving in the right direction. With child welfare, what was included in the budget is a salary increase for our local workers, which we know is really important right now. I know if you're on the ground, you are feeling very overwhelmed by the current vacancy rate or open positions in local departments, and a lot of folks are leaving child welfare altogether. And so we are going to be talking about workforce a lot this legislative session in all sorts of areas. One of the things that we want to make sure is that we lift up the workforce that serve children and families. And one of them that's really in crisis right now is child welfare. The other thing that's in the budget is the Office of Inspector General did a whole report on CPS and recommendations, and found that there were a lot of inadequacies in the CPS hotline. So they invested $8.2 million to support the infrastructure of the CPS hotline, to reduce those wait times and things like that. So we're glad to see that recommendation. One thing we are excited about is they have finally put in some money to invest in the Kinship Navigator program. The DSS asked for $2 million. They got a little less than $1 million. So that will expand our current Kinship Navigators from 6 to 12 programs, which we really want to continue to work to build a robust kinship care system. And then some budget language that was part of a recommendation from the Governor's Safe and Sound Task Force is to convene a work group that will examine the inclusion of residential treatment services in managed care. So if this were to pass in the signed budget, that study would start, and then we would have something for the following legislative session. Things that were not included in this budget, we wanted to have some trauma-informed support for frontline DSS workers. Again, just trying to trying to support that pipeline of workforce. That also goes into the next one. We wanted money to expand the child welfare stipend program. That is a program that pays for folks who are in bachelor's of social work programs or master's of social work programs to be able to get their degree paid for as long as they commit to working at least 1 year for each year that they were in the program. And it's been a great pipeline for folks getting into the workforce, but it does need to be expanded because right now it's completely federally funded. So that's something that you can expect a budget amendment that Voices will be working on to try to expand that program. We also wanted to see funding for a robust kinship care program, and that was not funded. We do expect for Senator Favola to be filing a bill this legislative session that would essentially do the same thing. So what we're going to be doing is supporting that bill and the implementation of that. And it's probably going to, I think, have a $9 million fiscal impact attached to it, which some of it that can be brought down from the feds though. And then one thing we were hoping that would be in the budget, but isn't, was the, it shouldn't say pilot, but parent legal representation. We know that for a lot of families in the child welfare system, one of the issues that they have is they don't have adequate representation. The Office of the Children Ombudsman did an entire report to the General Assembly about it, and it showed how much better outcomes kids and families had when they had proper representation. So their recommendation was actually to create a brand new office that was just for attorneys serving children and families in the child welfare sector. That wasn't included in the budget, but we weren't that surprised because the report got to them a little late. So right now it's looking like Senator Edwards will put a budget amendment in for that, but that will be something we will be also advocating for this legislative session. And I saw the chat going. I wasn't sure if there were questions as I was talking, but I think y'all are handling it.
They're great questions. And so I feel like we might want to, Allison, we want to read through some, come back at the end and answer them.
I'm
See
trying
that.
to read them really quickly.
Maybe from Christy about residential services included in managed care.
Yeah, so that one's really around coordinating payments and figuring out how we can support that system. But Christy, it's super complicated. So I'm happy to send you some of the language that explains it much better than I can, I think, in less than 60 seconds. So,
And was also a recommendation of the Safe and Sound
yes,
task force.
and
That's been looking at the hard to place kids.
Yeah, it's really about those kids who have been in residential for far longer than they should. Okay, so next slide.
All right, that is back to me regarding healthcare access. So what we do know is that access to quality healthcare and comprehensive coverage are vital for children and youth in Virginia to exist and to thrive, regardless of their income, their race and ethnicity, and their geography. And so as Emily alluded to, as early as April of 2023, the federal public health emergency could come to an end. And really what this means and why it's important is during the public health emergency, Virginia has not had to do any redeterminations for Medicaid, meaning that they've not had to look back and determine if people are still eligible, not had to do any of that renewal process. And so when the public health emergency ends, that will trigger the redetermination processes to begin again for everyone who is on Medicaid and FAMAS, many of whom enrolled during the pandemic and have never had to do a redetermination before and may not know what this process entails. Federal estimates show that children, Black individuals, and Latino individuals are most at risk of losing coverage during this process, the unwinding process, some of whom will likely remain eligible, but will lose coverage due to administrative reasons, such as they moved and their address hasn't been updated, so they don't get the letter saying they need to do their redetermination, or there are issues with language access and barriers for individuals that are immigrants and refugees. So to aid in this 12-month redetermination process, again referred to as Medicaid unwinding, the state budget includes $20 million for the Department of Medical Assistance Services, DMAS, to procure a one-time vendor to assist in the redetermination process for Medicaid enrollees, and then $10 million to the State Department of Social Services to cover the one-time cost of making overtime pay available to local DSS eligibility staff that will be performing Medicaid redeterminations for folks who are on SNAP or TANF as well. And so the staff, beefing up that funding for staffing is going to be critical, because while there is a 12-month process to do redeterminations, there are over 2 million people on Medicaid in Virginia. And so there will be a lot of work that needs to be done. And we want to ensure that for folks that do remain eligible, they're able to get through this process and understand exactly what they need to do to keep their Medicaid. And for folks that will become ineligible, for there to be someone to help them identify what their other options for coverage are. And so there's also, while not very specific about what this entails, there's also $250,000 included to develop a statewide strategic plan on the Commonwealth's healthcare workforce needs. Much like the behavioral health workforce and our teachers and other folks that work in these very important fields, we are experiencing a shortage of folks to provide these services in our community. So we are eager to see what this strategic plan on healthcare workforce will be. Unfortunately, there are several healthcare access investments that are missing from the budget, including a funding to study a community health worker Medicaid benefit. This would be a study to figure out how we're going to pay community health workers, who are extremely important parts of the continuum, and they really are the bridge to communities and healthcare, providing that bridge for language access, for really being a trusted partner in the community and understanding how to really translate medical and healthcare access pieces into easy to understand terms. We're missing funding to continue the partnership with Unite Us, which is an integrated e-referral system that unites government agencies, healthcare providers, and community-based partners to connect people to needed services in their communities. And there's a lot of agencies across the state that are using this, and the funding will run out in June of 2023 if there's not an investment made. And then funding to align Medicaid resource requirements for supplemental security income, SSI, coverage groups to help them align Medicaid and SSI to align. What this would have done is simplified enrollment and increased efficiencies by removing duplicative eligibility determination processes across SSI and Medicaid programs. And our partners at Virginia Poverty Law Center will be working on this as well. Something that we are really hopeful for in the upcoming General Assembly session is our friends over at the HAVE Coalition and TCI are bringing back Cover All Kids. And this is coverage option for children that are income eligible regardless of their immigration status. And so we are really looking forward to help advocate for that so that we can cover all kids and afford healthcare access to all of the children here in Virginia. Now I am passing it back to Emily Griffey.
We have a couple more points to cover around early education, and the juvenile justice system, and we'll have a little bit of time before we close things out. I've had a few folks ask some questions if they want to come off mute or ask questions to us directly. Keep your questions coming in the chat to have a chance to answer those as well. So in terms of early education in the budget, we were glad to see a boost in the early education space from Governor Youngkin. He included $20 million for the mixed delivery preschool grants in 2 targeted communities of Virginia, Petersburg and Wise County, Lee County, where we're glad to, where are some of the biggest areas of childcare deserts. The mixed delivery preschool means that it is a public-private partnership operating in all of the settings where early education happen, a public school, a private childcare, a home-based childcare. It means that we funnel our resources into any of these settings and ensure that they are high quality and great matches for working with kids and families. It also means that we can provide grants to resources so that there are a number of classroom opportunities for kids. It can fund a whole classroom or one whole entity, and we can ensure that those spaces are available for kids as well. There's language in here that the mixed delivery grants would be full day and year round as well, which is great for working families. There's also some language that adds flexibility within our childcare, our VPI programs and our childcare subsidy programs. One is some flexibility around the child-teacher ratio that we have heard is helpful from some providers as they meet staffing shortage needs and need to make sure that classrooms are covered, as well as flexibility around the teacher licensure for the VPI programs who partner with community-based providers to make sure that they have a great and solid number of options for community-based providers as well. So those 2 changes in language are included in the budget. While this is a really good start, we know that there's a lot more work to do in the early childhood field, huge shortages in terms of staff and access. So we'd like to see more additional resources included. We are hoping something more to the tune of $200 million than $20 million. So add some zeros there. And we'd like to get to that by funding both the expansion of the mixed delivery program, as well as our childcare subsidy, our childcare assistance program. The mixed delivery allows us to look at those classroom options, and the subsidy program allows parents to vote with their feet and have some choice in what they choose in their community. And both of those options really help to make the stronger early childhood system in Virginia. And next, in terms of additional education resources, we'll give a shout out to our, the next slide, Kristen, with our partners over at Fund Our Schools, who are also provide some more details on a webinar on Facebook tomorrow under the Fund Our Schools Coalition. We are here to see that there are some additional resources and teacher retention bonuses and targeted interventions for literacy and math. The budget did not include as much as we'd like to see around the overall standards of quality improvements and equity improvements in the budget, in particular to fund the teacher or instructor ratio for English language learner students. It did include an update to the funding formula based on the number of English language learner students that are served by our schools, but no additional improvements for the ratio of instructors to students. So some more work to do around this education budget to make sure that we are reaching the children who need a lot of help in our education system, and where we know that additional resources can be provided.
Okay, so here's bad news in the juvenile justice area. So if you've been following Voices over the past few years, you'll know that there's been a significant change and transformation around juvenile justice. They've really taken an effort to look at the whole child, to think about how do we serve children better in their communities? How do we focus on rehabilitation, family intervention, things like that, and reducing capacity for juvenile detention centers, because all the data shows that we're not really helping kids at all in any way when we put them into DJJ facilities. Unfortunately, the budget doesn't reflect those values that we have really worked hard that our state agency has given us and the legislature for the past, 8 years, really. So the budget does include some reversals on that. It would increase capacity at the Bon Air Juvenile Detention Center, having it so that more youth could go there, and also a funding to operate in at least 3 local juvenile detention centers at $2.9 million, again, increasing capacity for youth to go to further juvenile detention centers. So we will be actively opposing these measures and just talking to legislators to remind them of all of the great work that they have done with DJJ transformation, and hopefully we can get some of these items removed from the budget. I always forget to look at the chat while I'm talking. Okay.
Yeah, I think we're good and have opportunity to open up for any questions or drop anything else in the chat that we didn't cover. I'll say one thing at the nexus of education and juvenile justice. There are no specific initiatives in the budget related to additional law enforcement in schools or anything like that. There could be some bills that come up in that regard that we'll be watching as well. We have a new tab on our work page in our website that highlights a little bit more about this area of student belonging and connectedness that I encourage folks to look at as well. And I think if there is anyone else who is interested in asking a question or offering any more details, Nina, I pinged you if there's anything that you wanted to add about the school-based mental health pilot, since there were a number of questions in that space. You're welcome to come off mute. Anyone else who wants to come off mute and ask a question, you're welcome to as well.
Hi there, Emily. This is Nina. I responded directly to a question because I thought that would be easier, but I can put my email in the chat if anyone has specific questions and they want to follow up with me directly. I don't think I missed anyone, but
Great. Yeah, I think there was a question of what are the 6 school divisions, if you wanted to add.
oh, I might have missed that one. Well, a couple of the contracts are still in process, so I probably should not announce those yet. I can quickly look that up, but I want to make sure I don't miss anybody. But I know, yeah, let me look that up and I'll come back.
Okay. Thanks, Nina. And sorry, yeah, we didn't mean to put you on the spot here, just thought as you were answering and being able to add more detail here, having Nina Marino, who is our children's mental health key contact at the Department of Behavioral Health and provides oversight of these grants, is helpful to provide more information so that folks can advocate. Lisa, you have a question? Nope. Okay. Allison, there's another question from Christy.
Yeah, and Christy's question is really about like, yeah, we don't want beds at Bon Air ultimately, but would it be better to have beds locally in the community? I think we have really tried hard to stay away from that argument in general, some folks have advocated that if they're going to be in detention, they should be locally, but we don't want youth in detention at all, really. Yes, a very slippery slope. So we try to not corner the two arguments together and just say, really, youth need to be served by community-based services. And we really need to be thinking about what we can do to prevent detention altogether. And we also always need to frame detention will likely not yield the results that we want in that young person or in their family for the long term. And if anyone, oh, go ahead, Emily.
I think we're probably going to say the same thing. If anyone else has questions in the chat, to put them there. I see Nina wrote back about the school divisions that have been awarded already: Bristol, Lunenburg, and Hanover County. With some more in the pipeline here, and hopefully more to come. We do have one opportunity that you can take action right now and send a message to your legislators, reiterating the need for these areas in the budget and what some of the things that might be missing. I dropped a link into our action alert page where with one click you can put in your information and it will be sent to your state senator and state delegate. Take that opportunity right now to go ahead and send it and cross something else off your to-do list on a Friday as we wrap up our webinar a little bit early. Thank you to everyone who's been a part of this. Thank you to our members of our coalitions and partners who are able to hop on here today. I see folks from the Trauma Informed Community Networks. Thank you. I see folks who are Ready Regions and Virginia Promise Partners, advocates. Thank you. You see our awesome partners from the Commonwealth Institute who provides all the great budget breakdown and tax revenue analysis. So thank you for providing that, TCI and partners. Thank you for everyone who is typing in their info to take action. Other thing you can do is make sure folks are signed up for our emails, our Voices from the Capitol that come every Friday. You should get one from us this afternoon with this recording, as well as links to some budget recap information as well. You can forward that to your friends and encourage that they sign up so that they can get this information during the General Assembly session as well. We heard from Governor Youngkin yesterday. He expects things to go fast this General Assembly session. It's slated for 45 days. We're hearing they want it to be even shorter than that. So we are expecting things can go fast and furious, and if you blink, you might miss it. So send in your email action alert right now, and you'll already have something done in 2022. and be able to keep going with this momentum in 2023. This is a good start, but there's definitely some more work to do. And we need your help in advocating for kids and families in Virginia.